Hey everyone, welcome back to my channel. So today let's discuss about abnormal uterine bleeding or dysfunctional uterine bleeding. This is also known as menorrhagia. First, let's understand the definition of abnormal uterine bleeding. It is a vaginal bleeding from the uterus that is a variation from normal menstruation which may be due to abnormal frequency or menstrual period lasting excessively long. Next is heavier than the normal flow, that is less than 80 ml of blood, or being irregularity, that is variation in cycle length lasting more than 4 days. Abnormal uterine bleeding can occur as spotting or bleeding between your periods. Bleeding may be heavier or lighter than usual and occur often or randomly. Around 30% of women of reproductive age are affected by abnormal uterine bleeding. Now let's see the causes of abnormal uterine bleeding. There are a range of different causes which can be first endometrial or endocervical polyp. Around 50% of women have endometrial polyps, but most of these are asymptomatic. Second cause is adenomyosis. In these endometrial tissues in the myometrium, which tends to lead prolonged heavier periods. The third cause is fibroids. These are benign tumors of smooth muscle tissue and are extremely common with around 80% of women affected. Third cause is malignancy. Abnormal uterine bleeding can be caused by cervical cancer, endometrial cancer, and atypical hyperplasia. Fourth cause is coagulopathy. This means bleeding tends to be more severe in patients with clotting disturbances. Next comes is ovulatory dysfunction. This may be due to adolescents, polycystic ovarian syndrome, hypothyroidism, anorexia, athletes may be underlying causes. So next is endometrial dysfunction. This is essentially diagnosis of exclusion where no structural causes can be intensified. Seventh cause is iatrogenic, which may arise from use of medicines such as anticoagulants, hormonal contraceptive. Now let's see the signs and symptoms of abnormal uterine bleeding. Menorrhagia, that is heavy menstrual bleeding. The second symptom is bleeding at unusual times between periods, after sex, and during menopause. Unusually long periods, that is 7 days or more longer. Fourth is inconsistent menstrual cycles. So, homeopathy medicines for abnormal uterine bleeding. So, homeopathy offers excellent scope in the treatment of dysfunctional uterine bleeding. It offers a more holistic approach to the treatment of dysfunctional uterine bleeding. Homeopathy is much safer and better mode of treatment in patients who cannot tolerate the ill effects of hormonal treatment. It does not cause any unwanted side effects. Let's see the most recommended homeopathic medicines for abnormal uterine bleeding. The very first drug is Thalaspi bursa pastoris. It is very useful for treating abnormal uterine bleeding where periods last too long. Given when periods are profuse with expulsion of clots, there is bleeding is attended with severe uterine colic and cramps. Also, tendency for frequent periods. The best medicine for managing prolonged, profuse, and frequent periods in cases of uterine fibroid. This medicine can be taken 10 drops in half a cup of water daily 2 times. The second drug is phosphorus, useful to manage intermenstrual bleeding in cases of abnormal uterine bleeding. Useful when uterine bleeding is bright red and there may be a severe pain in the back during bleeding followed by great weakness. Medicine can be taken 30 potency daily 2 drops early morning. Next is ferromet. Useful for abnormal uterine bleeding in cases where the blood flow is pale, watery, and profuse. Even the smallest movement increases the flow. It is most recommended when during periods the face becomes fiery red and sometimes be attended with a ringing in ears. Also, there is presence of anemia in females. This medicine can be taken 2 tablets daily 3 times after food. The next is Trillium pendulum. It is very beneficial for treating abnormal uterine bleeding which is profuse and bright red. When bleeding is gushing in nature and is attended with backache and pain in the hips, There is a great bearing down sensation is felt in the pelvis, which gets worse when walking and standing. There is excessive bleeding, which may cause dizziness and fainting. This medicine can be taken in 30 potency daily 2 drops for 1 month. The last drug is millefolium. It is chiefly indicated for menses early with bright red fluent. Otherwise, it is considered the best alternative for bad effects of overlifting, post-operative weakness, overexertion. It is also prescribed in different types of bleeding disorders, hemorrhages where blood is bright red. This medicine can be taken millefolium 30 potency 2 drops daily 1 time. So that's all for today. Thank you for watching the video. Please do not forget to like and share the video. Also, please do subscribe to my channel to stay updated for latest videos. Till then, stay fit, stay healthy. See you soon in the next video.